Hello and welcome to Career Guarantee, where success is guaranteed by Mr. Shopon Kumar Sarkar, the pharma industry expert. Today we will discuss about the respiratory system. Respiratory system. Respiration equals to inspiration plus expiration. Respiration is the process by which oxygen from the lungs is carried by the blood to the tissues and carbon dioxide formed in the tissues by metabolic activity is carried by the blood to the lungs and is expired out. The process of respiration involves four stages. 1. Ventilation means the passage of air in and out of lungs during inspiration and expiration respectively. 2. Intrapulmonary gas mixing, distribution of oxygen rich in inspired air with the air already present in the lungs. 3. Diffusion, which means gas transfer across the alveolo-capillary membrane due to tension gradient. 4. Perfusion, means flow of adequate quantity of blood through the lungs so that the diffused gases are carried away. Respiratory system consists of nose, nostrils, nasal cavity, nasopharynx, larynx, trachea, left and right bronchus, left and right lungs, bronchioles, alveoli, and pulmonary capillaries. Lungs. Lungs are one of the pair of organs of respiration situated in the chest cavity on either side of the heart. The covering of lungs is called the visceral pleura. The covering consists of a closed sac of serous membrane. The lungs are fibrous elastic sacs that are expanded and compressed by movement of rib cage and diaphragm during breathing. They communicate with the atmosphere through the trachea, which opens into the pharynx. The trachea divides into two bronchi, which enter the lungs, left and right, and branch into bronchioles. These divides further and terminate minute air. About 30 alveoli open out in each alveolar duct, which leads from a respiratory bronchiole. The alveoli contains capillaries. This site is for gaseous exchange. Atmospheric oxygen is absorbed and carbon dioxide from the blood of the pulmonary capillaries released into the lungs. During expiration, carbon dioxide released by the lungs. The portion of lungs supplied by the terminal bronchioles is called an acinus, which is the basic functional unit of lungs tissues. Each acinus contains branching of respiratory bronchioles. The left lung differs from right lung in having two lobes instead of three. The left lung is divided in upper and lower lobes by the oblique fissure. On the right lung, the oblique fissure corresponds in position to that on the left lung. Right lung above, it is divided into upper and middle lobes by the transverse fissure. Each lobe of lung is composed of two or more bronchopulmonary segments. The right lung consists upper, middle and lower lobe with 3 segments in upper lobe, 2 segments in middle lobe, 4 segments in lower lobes. Total 9 segments are in right lung. The left lung consists upper and lower lobes with 4 bronchopulmonary segments in each lobe. Total 8 segments are in left lung. Therefore, right lung is slightly bigger than the left lung. In the respiratory system, respiratory tract are divided into 1. Upper respiratory tract extends from the nose to the larynx vocal cord. 2. Lower respiratory tract extends from the larynx to the alveoli. Trachea is a cartilaginous and membranous tube. There is plenty of seromucous glands in the submucous coat. Mucous gland along with goblet cell traps dust in the inspired air and air is moistened by contact with moist lining of serous glands. Functions of respiratory tract. The inspired air is modified during its passage through the nose. 1. Filtering effect. Dust particles are caught by the nasal hairs in the nostrils. Air can flow uninterrupted through the zigzag passage of nasal cavity. Ciliated epithelium help to keep the respiratory passages free from foreign particles. 2. Air conditioning effect. The inspired air is brought to near about body temperature and is humidified before it is permitted to enter the deeper air passages, cold and dry air coming into direct contact with lungs. Functions of respiration: 1. Gas transfer. 2. Regulation of carbon dioxide of blood. 3. Regulation of blood pH. 4. Excretion of certain volatile gases like chloroform, ether, ammonia. 5. Pumping action. Cough reflex. Cough is a protective reflex by means of which respiratory passages are kept free from foreign matter. Sensory stimulus is necessary for this reflex, either physical or chemical irritation of the respiratory tract. Sneeze reflex. It is very much like cough reflex, but here the zone of afferent stimulus is in the nose and the afferent pathway is in the trigeminal nerve. Cough. It is a forceful expiration with sound. Coughing is a reflex phenomenon caused by irritation of the mucous membrane of the respiratory tract. It is an important protective reflex in which the irritant material is got rid of from the respiratory tract. Cough is of two types. 1. Dry cough, no mucus production. 2. Productive cough, where mucus production takes place. Dyspnea. Dyspnea means difficulty in breathing associated with a sense of distress. It is to be differentiated from hyperpnea, which simply means hyperventilation as occurs in muscular exercise and usually not associated with sense of distress. The factors responsible for dyspnea may be classified into three categories. 1. Alteration of chemical composition of blood, hypoxia, hypercapnia, etc. 2. Excessive work of respiratory muscles, congestion, fibrosis, etc. 3. Psychogenic dyspnea. Anoxia or hypoxia. Anoxia is a condition characterized by inadequate or decreased supply of oxygen to the lungs because of extrinsic reasons. The term hypoxia is more appropriate and is used synonymously with anoxia. Classification: 1. Anoxic type of anoxia or arterial hypoxia. 2. Anemic type of anoxia. 3. Stagnant anoxia or hypokinetic hypoxia. 4. Histotoxic anoxia. Altitude anoxia. Anoxia at high altitude is due to low barometric pressures. Asphyxia. Improper aeration of blood. Hyperpnea means increased breathing. Orthopnea. With severe congestion, cardiac failure, dyspnea occurs even at rest. The patient feels more comfortable in sitting position than lying down. Cyanosis. It is a clinical condition in which the skin and mucous membrane assume a bluish color. It depends upon the absolute amount of reduced hemoglobin present in the blood. It may be local or general. When general, it is best seen at the lips, nose, ears, cheeks, hands, feet. Acclimatization. This term means the adjustment of the body with high altitude. Diffusion. It means movement of a substance from an area of high concentration to an area of low concentration. In the present context of respiration, the diffusion of oxygen from alveoli to pulmonary capillaries and of carbon dioxide in the reverse direction is to be considered. Perfusion. The term perfusion simply means blood flow, and in this context of respiration, it means blood flow through the lungs. It is approximately equal to 5 liters per minute. The ratio is alveolar ventilation divided by perfusion equals to 0.8. Control of respiration. The control rate of respiration in an adult is 14 to 18 per minute with a total tidal volume of about 500 ml. The rate and depth of respiration is adjusted according to the requirement of body. For instance, during muscular exercises, metabolic activities are increased and the demand for oxygen by the working muscles is increased. At the same time, a large amount of carbon dioxide is produced by the muscles and it becomes necessary to eliminate it. Thus, in muscular exercise, the respiration increased. In fact, the increase in minute ventilation is directly proportional to the magnitude of muscular exercise. On the other hand, respiration is depressed during sleep when the metabolic rate is low. Since the rate and depth of respiration can be accurately adjusted to metabolic needs of the body, there must be an efficient mechanism for its regulation. Like other physiological functions of the body, the act of respiration too is controlled by a special group of nerve cells in the brainstem, which constitutes the respiratory center. The activity of this center is controlled by many factors. Please subscribe our channel and hit the bell icon. Thank you.